Hello, my name is Dave Daniels, and my brief poster presentation will be on the utilization of KY jelly and cryotherapy for treatment of giant cell tumors of the distal femur. Giant cell tumors comprise 5% of primary bone tumors, and although are generally benign with a 1 to 9% chance of metastasis, are known to be locally destructive and can cause significant damage to surrounding biologic architecture, causing pain and dysfunction. Therefore, many treatments have been reported in literature, including curettage with bone grafting, curettage and cementing, wide resection with endoprosthesis implantation, and cryosurgery, as will be discussed here. Goals of treatment for these tumors include eradication of the tumor, reduction of iatrogenic complications, and simultaneously reducing risk of local recurrence, which have been demonstrated up to 65% depending on methodology of treatment. Cryosurgery has reportedly been amongst the most successful for accomplishing these goals. It was originally described by Markov as a direct liquid nitrogen pour technique into the area of concern, and since then many variations have evolved to include one, the semi-solid medium technique that we'll be describing here as a way of transmitting cryoablation. Our patient is a 30-year-old African-American female who originally presented to her primary care after a ground level fall with knee pain. Although no fracture was noted on radiographs, this lytic lesion prompted advanced imaging demonstrating a significant occupation of this lesion within the distal femoral condyle. Our patient was taken to the operating room where a fresh frozen specimen demonstrated giant cell tumor without malignant transformation. A gross excision was then performed, leaving behind significant bony cavity that was then filled with KY jelly. Ice force probes were applied for cryoablative therapy, and a freeze-thaw cycle to negative 150 degrees Celsius was performed, followed by repositioning of the probes and a second freeze-thaw cycle. After this was removed, cement was placed into the bony cavity, and a six-hole locking plate was then placed for prophylactic fixation of the distal femur. At 8-month follow-up, there was no radiographic evidence of tumor recurrence, and clinically, our patient was improved and reported improved knee pain and as well as function. Successful treatment of giant cell tumor can be defined by several parameters, including eradication of the tumor, preventing local recurrence, and reducing iatrogenic injury and complications. One of the largest case series to date, involving 102 subjects, describing cryotherapy with direct application of liquid nitrogen, demonstrated a recurrence rate of 8% after 6.5-year follow-up, with the following complications: 6% of patients experienced fracture, 3% had reported partial skin necrosis, and less than 1% with degenerative changes of the knee. So although a relatively successfully demonstrated technique, there are some notable disadvantages to liquid nitrogen. Perhaps one being exposure of the bone to extreme temperatures has been demonstrated to decrease the strength of bone by about 40% over the ensuing weeks, which can increase the risk of fracture after treatment. And the low viscosity contributes to the difficulty controlling the biologic zone of exposure, placing surrounding structures such as vessels, nerves, and other tissues at risk for damage. We believe that KY jelly can serve as a potential answer to some of these complications. KY jelly happens to reach the threshold temperature for inducing cellular apoptosis and neovascularization at a temperature that is 46 degrees warmer than traditional liquid nitrogen, exposing bone to less extreme temperatures. As a semi-solid medium, it is more easily controlled than liquid nitrogen, therefore offering a more targeted biologic zone of exposure and limiting risk of surrounding structures such as the vessels, nerves, and muscle that may surround the tumor. As a significant limitation of this study, it is a case report with one subject, therefore limiting generalizability to patient populations, as well as only having short-term follow-up. In conclusion, the management of giant cell tumors are a highly debated topic within the literature, and there's a myriad of strategies described for managing these tumors. We believe that KY jelly should be strongly considered as a method for cryoablative strategies due to its several noted advantages, one being in the induction of apoptosis at less extreme temperatures than liquid nitrogen, as previously mentioned, theoretically reducing risk of subsequent fracture after treatment. And its semi-solid properties allow for a more targeted biologic zone of exposure, reducing risk of surrounding structures to damage. And the abundant availability of this particular material in surgical centers make it readily usable for cryoablative therapy. Thank you for your time, and I thank you to Dr. Stephen Jones and Dr. Benny Lindeque for their support with this project.